Hi, I'm Elizabeth Ngo. I'm part of Dr. Sasha Prisco's lab, and we investigated the role of the antifungal fluconazole in pulmonary arterial hypertension. Pulmonary arterial hypertension, also known as PAH, is a severe and progressive disease characterized by increased pressure and increased vascular resistance in the lungs. This causes the heart to work harder, which eventually leads to heart failure and death. It is known that systemic inflammation is a key driver in PAH disease severity, and our lab previously found that modulating the intestinal microbiome mitigates systemic inflammation in PAH. However, very few labs have looked at the role of fungal species, which makes up less than 1% of the intestinal gut. The aim of this project was to determine whether modulating the intestinal microbiome or fungal species alters PAH disease severity. To do this, we administer the broad-spectrum antifungal fluconazole to an MCT PAH rodent model. We hypothesize that modulating the intestinal microbiome will alter PAH disease severity. We had three experimental groups: our healthy control, MCT vehicle, and then our treatment group, MCT fluconazole. Both MCT groups received a one-time injection of monocrotaline, or MCT, to induce PAH, and then 2 weeks after MCT injection, we started fluconazole treatment to the fluconazole group, or we gave a 50-50 PBS to ethanol solution to the vehicle group. The vehicle and the fluconazole group received their respective treatments every day via oral gavage until our endpoint analysis on day 24, where we collected fecal samples, did echocardiography, invasive pressure volume loops, and collected tissue for histology. From the invasive pressure volume loops, we saw that fluconazole treatment reduced the right ventricular systolic pressure and reduced the effective arterial elastance. Both the right ventricular systolic pressure and the effective arterial elastance are parameters of vascular resistance, so this means that fluconazole treatment reduced vascular resistance, improving blood flow, and reduced pulmonary hypertension disease severity. To support our physiological findings, we also did histology of the small lung arterioles, as shown by these representative images. You can see in the vehicle group that they have severe medial wall thickening. It's important to note that monocrotaline progressively increases medial wall thickness, and when this medial wall thickens, it decreases the size of the lumen, increasing resistance for blood to flow. In contrast, you can see in the fluconazole arteriole that there's significantly less medial wall thickening. And this was also shown quantitatively when we measured the percent medial wall thickness. We saw that the fluconazole group had a reduced percent medial wall thickness compared to the vehicle group, suggesting that fluconazole mitigated pulmonary vascular remodeling, which can explain the reduction in vascular resistance that we saw in our physiological results. Additionally, we also evaluated how fluconazole affects right ventricular function. From echocardiography, we saw an improvement in the right ventricular free wall thickness change in the fluconazole group. The RV free wall thickness change is a way we assess RV contractility. So the increase in the fluconazole group means that the RV in the fluconazole rats was better able to contract and eject blood. And this can also be seen in the improvement in the right ventricular ejection fraction from invasive pressure volume loops. We saw that fluconazole had a higher RVEF compared to the vehicle group, meaning that there was a greater volume of blood being ejected from the RV in the fluconazole rats. Most importantly, though, we saw an increase in the RV-PA coupling value in the fluconazole group. And the RV-PA coupling value taken from invasive hemodynamics is the gold standard for assessing RV function. It's the ratio of end-systolic elastance over effective arterial elastance, and the higher the ratio is indicative of a healthier RV. And looking at this RV-PA coupling value, you can see that it's inversely related to effective arterial elastance, which is, again, a parameter of vascular resistance. So the increase in the RV-PA coupling value in the fluconazole group shows that fluconazole treatment augmented right ventricular function because it reduced vascular resistance. Additionally, we also wanted to see how fluconazole alters gut morphology. We did histology of the small intestine's jejunum, and we chose the jejunum because it's the section of the small intestine where most of the nutrients and metabolites are being absorbed from the external into the internal environment. Shown here are representative images of the jejunum, and you can see these finger-like structures called villi, and these villi contain these goblet cells. The goblet cells secrete a mucus that provide a protective layer over the villi, and the villi and mucus work together to function as this protective and semi-permeable barrier. From histology, we saw that the fluconazole group had an increased villi length and a higher abundance of goblet cells per villi compared to the vehicle group. And this suggests that fluconazole enhanced the integrity of this intestinal epithelial barrier, possibly preventing the movement of pathogens and metabolites that could be pro-inflammatory and driving disease severity. Finally, from collecting the fecal samples, we did ITS2 sequencing and shotgun metagenomics. To analyze our metagenomics and ITS2 sequencing data, we did a partial least squares discriminant analysis as shown here. And the partial least squares discriminant analysis is a way where we can integrate complex data, cluster similar compositions together, and visualize similarities and shifts. And so from the partial least squares discriminant analysis, we saw that fluconazole altered the microbiome, but by altering the fungal species, it also created a shift in the microbiome or bacterial species. This suggests an intersectional relationship between the fungi and bacterial species. But looking at these figures, you can see that the control, the MC2 vehicle, and the MC2 fluconazole group have a distinct signature in the myco and microbiome. And this highlights the importance of gut composition in PAH pathology. So in conclusion, we saw that fluconazole reduced PAH disease severity and augmented right ventricular function, and we think this is due to how fluconazole altered the fungal and bacterial species and how it enhanced the intestinal epithelial barrier. Since most of our immune cells reside in our gut, in the future, we would like to evaluate how fluconazole modulates immune cell populations in the intestine and the lungs, and we will also investigate gut composition in PAH patients. Before I go, I would like to thank my incredible mentor, Dr. Sasha Prisco, and amazing lab manager, Ben Kramer, for supporting me in this project. And I would also like to thank the Undergraduate Research Opportunities Program Europe for funding part of this project. Thank you for listening.